We're gonna record. Got it. Okay. So about 2 weeks before the residency, Jonathan gave his notice, which he's certainly entitled to do. I wish to God he had waited until August to do this, but Elizabeth has really, Kat and Elizabeth have really stepped up in particular. For those of you who haven't met Elizabeth yet, probably up there in the top screen, but Elizabeth Welch is say hey, is our intern for the summer. So she is an undergraduate student at GW. She's a student in another program that I co-direct, the Summer Institute for Health Promotion in Underserved Communities. That's a 10-week program that just finished.
And wants to be an MSW. Yes, got another one.
Right. So so Elizabeth and Kat have a little connection going here. So, but thanks, Elizabeth delayed some of her internship hours until after the completion of the program, so she could work with us here. So I'm really happy you've done that. So Elizabeth has put together all the scheduling packet, the bio packets, which we'll send out. Looks like this morning even before Shane's talk is done, and has been very, very helpful. So that's really been terrific. So we are recording, and we will be doing that for pretty much all of the sessions that we've got going on. So now that we have a critical mass of people, just a reminder about make sure you mute if you're not speaking. And most of you know each other, but not everyone does. And frankly, for myself, it's great to go around again and sort of get the, introduced, the basics, who are you, why are you here? So your name, your pronouns, of course, from whence you hail, and what's your gig, why you're here, why this is a thing. I think I'll start. We'll go to our faculty person present right now. After that, with Kat and Elizabeth, you can introduce yourself too, and then we'll go to current students and returning students. But I'm Stephen Forcell, he, him pronouns, and I started this program close to 10 years ago, and that's why I'm here. I'm a developmental psychologist by training. One of the reasons that this program became an idea for me was because I was co-directing this summer institute that Elizabeth's a part of, which teaches undergraduate students about health promotion in underserved populations, more broadly speaking. And when the Institute of Medicine report came out in 2011, and it looked like the federal government was going to get really serious about, and private industry and medicine and all that was getting serious about helping LGBT people, we thought this program would be needed for at the graduate level. And sure enough, the university said, go ahead and do it. Here we are 10 years later. So that's my gig. Elizabeth, actually, why don't you go first and just say a little bit about yourself, and then we'll go to Kat, and then we'll start going around with students. So go ahead.
Sure. I'm Elizabeth Welch, they, them, or she, her pronouns. I'm interning here for like one more week while I try and smooth out some of the material for distribution. And yeah, that's about it, I think.
So you're interested in social work. That's like sort of what drew you to the summer program?
Yeah.
Yeah, good. Well, awesome. Thanks for being there. Kat, you go.
Hey, y'all. For those who haven't met me, my name's Kat Carrick, prefer she, her pronouns. Like to really mess with people's heads, so you can call me any pronoun. I have an MSW and a PhD in social work. I've done everything from grassroots organizing to clinical to inpatient, outpatient. I was director of social service for Atlantic City Medical Center, and I oversaw 35 social workers and a level 1 trauma unit. I've been a grassroots activist for over 30 years. I cut my teeth with ACT UP, who used to meet in my living room for Pittsburgh, and the Lesbian Avengers. So I know how to eat fire and survive. I came on to the program in the second year. I stayed in the program because I really believe in Steve's vision, and I also, this is my life's calling. This is what I did my dissertation on, how we train healthcare professionals to better serve the LGBT community. It is not what pays the bills, but it is my calling. I've been on faculty since the second year, or no, the second year I was a guest lecturer, and then the third year I came on as faculty. And I developed and teach the rural health course and the lesbian health course. And this summer I am teaching the multidiscipline course, which several of you are in.
Awesome.
That's me.
Great. Great description. I'm just going to go actually left to right, top to bottom on my Brady Bunch squares and hit people that way. So your Brady Bunch squares may look different than mine, but that's the way I'm going to make sure I get this all in. So Joe, you were like one of the first to pop up. So why don't you go next?
So I'm Joe Waters. I use he, him pronouns. I'm actually a physician. I'm an adolescent medicine fellow at Children's National in DC. And what else are we supposed to say? That's it.
Okay, that's good.
Whatever you want to say.
Yeah, right. It can be as long or as short as you care to, but not too long. Kate, you are next. I think you're Peter Brady, so go.
Sounds good. So I'm Kate. I'm a returning student, as well as will be keeping you distracted for hopefully about 90 minutes tomorrow as a guest lecturer. So I was in the 2016 cohort. Currently, I am a PhD candidate at University College London. So to let you know, at the other end of the day, all should go well, given how today has gone here. But my interests are reproductive justice, particularly kind of expanding the notion of who needs services like that and what family is and means, etc. So that's me.
Brilliant, thanks. Liana, Dr. Chen, I think you're next.
Hi, everyone. Morning, good evening. My name is Liana Chen. I teach at GW. I teach in the Department of East Asian Languages and Literatures. My main field is drama, but then in my program, I mostly teach Chinese literature. I also teach Taiwanese literature, and the reason I'm here is because, well, of course, this year I'm on sabbatical, so I started to think what I can do, differently to develop, different perspectives, and perhaps gain some insights for myself as I continue to develop my professional career in teaching Sinophone or Chinese literature and culture. Okay, so another experience of mine, some of you have already heard me sharing this, is that my ex-partner transitioned in 2013, and I think now is a good time for me to reflect upon that that journey. It's distant enough now, but then I now, after a few weeks of reading, I want to say that this is very helpful for me to also find ways to incorporate current, our experiences and then the current situation of Taiwan's LGBTQ community in my future course development. So yeah, that's why I'm here. I'll stop here.
Awesome. Thanks so much for joining us too. I was so pleased you came on. It's fun. Jared, I see you next.
Hey, hi everyone. I'm Jared. I use he, him pronouns, and I am in the Detroit area. I'm a master's licensed psychotherapist and a doc student in clinical psychology. And I came to this program because I think the role of psychologists and health professionals in general extends beyond the case room or therapy room with patients, and that we have a role in policy and in advocacy. So yeah, that's a little bit about me.
Great, thanks, Jared. And Jared's one of our returning 2-year students too, so it's glad to get some, experience under the belt, and you can share your experience from last year. Louis, I see you next.
Good morning. Louis Rosario McCabe. I use he, him, his pronouns. I'm a women's and gender-related health nurse practitioner at the University of Rochester Medical Center. I also teach undergraduate women's health and women's and gender-related health to our accelerated RN students. Really, the reason I'm here is our School of Nursing doesn't have a robust LGBTQ curricula. And I feel someone needs to do the work to get it infused throughout our curricula, be it extracurricular activities or actually curricular specific content. So learning a lot already in these short 5 weeks.
Great, thanks, Louis. Tyler, can you go next?
Sure thing. My name's Tyler. Good morning, everyone. I am a pediatric ICU nurse in Richmond, Virginia. I'm only finishing my first year of practice this summer. And I'm here as LGBT health is something I've been incredibly passionate about since, I don't know, since I came out. I feel like I've always cared about the issues that face our community. And I came here to build like the rest of my career kind of on this foundation so that I have somewhere to start. And yeah, I hope to enter academia, enter advocacy, and also bring all of this to my clinical practice.
Great motivations, exactly right. Milton, say hello.
Hello, my name is Milton. I use he, him pronouns. Study education in public health in the University of Puerto Rico. I work there in a research team called the SEX team. And from there, I learned about this program with some past cohort member, Damian. And as Tyler, I'm passionate about LGBT in general and doing my career around it. So yeah, that's why I'm here. I'm almost finishing the certificate, and I was hoping that there was presencial there in Washington, but yeah, here we are.
Thanks, Milton. It probably also bears mentioning that Damian Cabrera, who Milton mentioned from UPR, University of Puerto Rico, Damian is now at the National Minority AIDS Council in Washington, DC, and we helped with some references for him when he was applying for that job, which is also where our office admin, Jonathan Ayala, has skipped off to. So Jonathan will continue to be a friend of the program and help us out moving down the line. So we've been, keeping it all in the family, and that, the importance of our network, couldn't be more evident with that. So I think that's really terrific. Caroline, go ahead.
Hi, I'm Caroline. I use she, her pronouns. I have a Master of Social Work from USC, so I've been in LA and actually just moved back to Connecticut full time. So I'm the head of case management at an LGBTQ medical clinic here called Anchor Health. And I really wanted to know more about health policy and how I can help clients. So here I am at the program.
Great, thank you for being part of it. Jesh, I see you next. Still muted.
Wait, did you say Josh or Jess?
I see Jesh is what's in your the name on the screen, so that's how I addressed you.
Oh, okay. I'll put sorry, I've got oh. Sorry, I've been having some technical difficulties. Can I go after? Sorry.
We hear you fine. If you want to wait, I can have Jessica go first. So. But we can hear you fine.
I think
Steven.
Jessica is signed in on her phone as well as on the computer.
Yeah,
Oh, okay. Great. No, you're the
So-
last one. I was going to say, this is confusing me. I don't know who Jesh is versus Jessica. Yes, Jessica, it's you. It's all you. So we hear you.
Get some coffee, Steve.
I'm seeing double.
He definitely wins for the most interesting background, or you definitely win for the most interesting background.
Hi, yeah, can you hear me?
Yes.
Sorry, yeah, I've had to sign in on my phone and my laptop as well. But yeah, I'm Jess. So I'm just starting GP training. And I've had an interest in LGBTQIA plus health since I started about 6 years ago. I'd like to tailor my training and to, sort of specifically with that, and then also just to be able to make policy that's more inclusive. I'm really sorry, I can hear myself echoing, so it's hard to talk.
I think, Jess, if you mute yourself on one of them, you should be fine.
Oh, okay. Yeah, that's probably it though. Sorry, that was a bit stilted.
That's where are you located?
So I am located in Edinburgh at the moment, and I've just moved from Australia, so I got back a few days ago.
Okay.
Yeah,
Welcome.
and Jessica will be actually starting in the fall. So she's not currently in any classes, and that's, if you've not met Jessica, that's why, because she'll be starting in the fall for reasons that have to do with moving in schools and things like that. So we look forward to having you in classes in the fall. And I
Do you
think that,
prefer Jess or Jessica?
Jess or Jessica.
Okay. And pronouns?
She, her, but happy with they, them as well.
Okay. Thank you.
and that's a good segue into one of my sort of reminders about fall registration. It looks like most everyone is set up to be registered for the fall, but if you are a first year, 1 year student, in other words, doing the program in 1 year, you should be at this point registered for the mental health course and one of the 2 electives. We have transgender health and rural LGBT health. If you fall in that category, you should be registered for both. If not, we need you to do that this week, because we have some deadlines on our end that we need to meet by the end of this week. So make absolutely sure you do. I'll be going through the rosters and annoying people that haven't done that. For returning students, you probably know what it is you need to be getting, but you need to be registered for at least 1 course to remain active in the program. So, and it would likely be one of the 2 electives, either transgender health or rural LGBT health. So please make sure you do that if that's where the category you fall into. The other, so a couple other things about what we're going to be doing this week. Again, we're recording every session as a reminder. We'll let you know about that before we start, with the exception of a few sessions. We, as always, do evaluations of each session that we do. So there is a link that I sent around to all the students. And we want the students to complete the evaluations. Faculty, we help create the session, so you don't need to, or an alumni, so shouldn't be completing it, but students should. And it's a very, very simple, sort of typical, a Likert thing on about 5 domains, and then an open-ended thing if you wish to comment. So every time we complete a session, I'll try to remember to send in the chat the link to the survey online, and you just write in the name of the session, the date that it happened, do the ratings, I believe it's on a 1 through 5 scale, and then leave any comments you want to do. It's easiest to do that right after the session, just so it's out of the way and you don't have to try to remember what's coming up after that. Go back and get it mixed up with what you've seen since. So regarding the recorded sessions, we will post them. The we sort of upgraded our Zoom account so these things get stored in the cloud, which should allow for quick recording and download. We will download them onto our hard drive and then upload them into some format, some platform where you can access them. Probably through, well, we'll figure out which one that is. It'll either be through a private YouTube channel or through Blackboard, where everyone can have access. So you should be able to go back and review those after the fact. And we'll let you know more about that as we figure it out. I also this morning sent out, when everyone started, they should have received the graduate student handbook. Jonathan would have sent that to you. Both the CCAS version. So CCAS is the Columbian College of Arts and Sciences, which is where the our program is housed, graduate program is housed. But there's also the LGBT health policy and practice specific student handbook with the details on our particular program. And the last thing is that if anyone who is accessing federal student loans in whole or in part to pay tuition, there is a disclosure, a gainful employment disclosure form that you need to complete. I will send that around, and you only need to sign and return it if you are indeed using the student loan program. But that's our way of making sure you understand the disclosure, this requirement of Title IV, that we get that information, or your acknowledgement of that information coming back. So I just wanted to do a couple of highlights for the schedule for the week. I won't share my screen since you have this really in front of you. But so for the things coming up this week, we've got some wonderful talks, obviously, from some terrific people. What immediately follows this meeting here is Shane Snowden. Shane has the distinction of being the only presenter who has presented at each and every residency since our inception. Shane is a lot of you are taking the policy course with her, and it was a real coup that she joined us as the policy course instructor starting this year. And Shane, as you probably know, she founded the health and aging interest offices at the Human Rights Campaign. She started the UCSF LGBTQ Center. That's the very, very first university-based LGBTQ center in the country. Is a tremendous consultant and knows an awful lot about policy and also about hospital systems and care. And she's a wonderful presenter. So most of you know her already. Later today, Dr. Bennett, Corey Bennett, who is normally our transgender health instructor. Corey and their wife, Elizabeth, are having twins this fall. So Corey is taking a sabbatical. Stand by for some news on the instructor team. You will be getting information about that, but this will be a team talk course for the fall, including a number of alumni and from some esteemed transgender health folks. But Corey has agreed to join us this afternoon to do the gender identity session. And this is a session that we started a number of years ago when it became apparent that not everyone, all of us come to this program with some level of expertise or understanding of any of the number of the letters of our acronym. But gender identity was something that a lot of people struggled with, particularly when you get into non-binary pronouns and things like that, identities and pronouns. So Dr. Bennett will be here to sort of make sure everyone is up to speed on that and give a primer on gender identity. And it's always, Corey always does a great job with that. And then the last thing for today is the community organization and provider panel that Kat will be moderating with some, terrific people, panelists on that. So I won't go through all the details of the rest of the week, but I do want to point out that there are a number of things to sort of take a look at. You will see what are identified as student debriefs throughout the week. And This is an opportunity for students to gather on their own. So when we get to the student debriefs, the first one is tomorrow. And then there's a couple more throughout the week. The purpose of that meeting is for faculty to clear out, alumni to clear out, and have it just be current students to, if you haven't really had informal time to talk with each other, to do that. But also to sort of process, what we've done during, to that point in the program. And then, a couple opportunities throughout the week seem to be sort of the sweet spot for doing that. Also, I just want to point to the panel we're doing on Wednesday, the Queer Art and Creativity panel, because we haven't done something like this in quite a while. Actually, since our very first year, when we did sort of a creativity and mental health and community building piece, and that I'm particularly fond of it just because we've got an alumnus coming back and some great artists who will talk about the meaning of their creative process and what it means to their both identity and health in the community. We'll talk about Mark Schoen's presentation on PSAs, which is kind of fun. We'll talk about that Wednesday morning. Obviously, the forum on Wednesday night is going to be really, really terrific. Our LGBT health forum we've done from the very beginning. Last year, because of the pandemic, we really didn't feel we could really put it together to have a forum online that summer. So last year was the first year in our history that we did not have the forum. What the forum typically is in a normal year is an event in person that we do, open to the public, free to the public, where people can come and just watch, a panel discussion. In the early years, we had 3 keynote people do mini keynotes, and then we have a panel discussion with some additional panelists focusing on certain themes. This year being the second year where we were forced into a virtual format, we decided we did want to do the forum. I think we've got a pretty good program set up here. We'll be focusing on aging in the LGBT community and LGBTQ elders. There will be a separate link for that is in your program. You probably saw the solicitation for people who are outside of our program to register to get it. So folks who are not in our program as students or faculty or alums need to register online. There's a link that you just go and you fill out a few fields. We do ask people if they're able to make a donation to our scholarship fund. It's completely optional. I will note that we have about $300 raised so far, so that's good from people who did decide to make a donation. And we've got, I think, over 40 now, in addition to students signed up to come. So that it'll be a nice event. But for that event on Wednesday, Carrie Candrian, who is a researcher in a medical school in California, but also a new GLAMA board member and has expertise in working with LGBTQ elders, will be on the panel. Bob Linscott, who works at Fenway on the LGBT Aging Project. Dee McGreeny over at Whitman Walker, who is their director of external training, and she has LGBT aging in her portfolio. And Erin Tax, who is the policy director over at SAGE, which is the primary advocacy group for LGBTQ and queer elders. Erin will be joining us through recorded. We won't be a live presentation. He is not going to be available to be live, but he's recording us a nice little pre-recorded thing. So it'll be his presentation, and then the rest of us will have a conversation. So that's in the evening on Wednesday at 7 p.m. Eastern, and hopefully you can make that. The other things I just want to point out about the week: Thursday traditionally has been our Capitol Hill Day. And that's the most exhausting day in DC, particularly if it's a hot and humid summer day, which DC tends to be. I'm glad I'm not there right now. But what we would normally do is we'd leave, 9 in the morning, we'd gather in front of the residence hall where most people are staying, hop onto a bus and head up to Capitol Hill. And somewhere throughout the day, we would visit with Health and Human Services personnel at the Humphrey Building. That was a tradition until the Trump administration, when that stuff was verboten, and the folks who were advocating on LGBT community behalf within HHS and their bureaus, they actually snuck out of Humphreys and came to visit us. But now that we're back to sort of a normal presidency, we can be entertained by them in-house. So next year, when we're back to in person, we'll probably go to the Humphrey Building again and visit with them there. But this year we've got a virtual version of that, and the folks over at HHS have put together various people from HHS and different HHS bureaus, including HRSA and SAMHSA, who will talk about what initiatives they've got going on the federal government level. We also typically go to Capitol Hill to visit with one or two lawmakers. Tammy Baldwin's office, unfortunately, the senator herself will not be able to join us this year. She has joined us at least 3 times in the past, but the Senate schedule is such that she's not able to join us. But her senior policy advisor, Aaron Dugan, will be entertaining us towards the end of the day. We will also have a visit, actually start the day, which usually ends the day when we're out on Capitol Hill, is with Whitman Walker Health. And Whitman Walker is for those of you not familiar, that's DC's sort of like most LGBTQ friendly medical practice. Started as really a gay men's health crisis center in the 70s prior to HIV. Most people don't know that. Has developed over the years, eventually into an FQHC and now a broader organization. And they will talk about the work that they do. On that same day, right in the middle of it, we will have a alumni and student mixer. When we're in person, we typically go out to, we'll find a space at a, local restaurant and just, buy some food and stuff and lay that out for alumni and new students to get together to talk amongst themselves. This is another situation where faculty and non-student or alumni are asked to clear out, and students and alumni can get together and just, talk amongst themselves. And new students can learn from what the alumni have their experience in the program, and alumni can hear about what's new going on in the program with new students coming in. And then we've got, of course, a full day of stuff on Friday. The only thing I'll point out there specifically about the Friday is that we've got our capstone, sort of our first capstone course meeting. Now, most of the course itself doesn't start technically until the spring, but everyone is and should be thinking about the capstone ideas beginning now. And that will be our first convening of folks to, start talking about ideas. So myself, there will be 2 alums presenting their capstone, their completed capstone projects. And actually, they're not always. One of the ways you learn from prior capstones is both from the things that went well and did not go so well. So you'll get a little bit of each, and things to sort of bear in mind when you're doing your planning. So you'll have two separate capstones presented in about a 10-minute block each. And Dan Daly, who is our resident project management expert, will march through some very, very good principles on how to organize and manage putting together a research project or an intervention, or whatever your project or whatever your capstone is, help you march through the steps and organize it so that you hit as few roadblocks as possible. So those are the things about this week that I really sort of wanted to point out. And at this point, I think we've hit on most of the issues we need to. I do see that Dr. Mabena has joined us. That's one thing. If you want to say hello real quickly, we're going to be hearing from you in a panel later this week. But as long as you're here, would you like to unmute and say a quick hello?
Later today.
Yeah, later today, which is also later this week, Kat.
Hi, everyone. Hi. I was actually testing if I'm on the right day because I'm a bit confused with dates. So, hi, everyone. I'm joining in from South Africa. I just wanted to see everyone and say hi before my session with Kat and them later on.
Yeah. Later today, yes, indeed.
Yeah.
at
well,
3:30 to 5 on Eastern Standard Time.
yeah, which
So
is
I'm,
late at night for you, I know.
It is
I
9
know.
p.m. for me. Yeah,
I'm very sorry, honey.
that's okay. It's all right. No, no problem. Nice to see everyone.
All right. Is there anything else anyone wants to sort of bring up or discuss or ask about the week or talk about or anything of that nature?
I think it's going to be less stressful for folks because we are virtual. So I'm going to take the liberty of any time I need to get up and stretch or move or answer the doorbell or whatever, I'll just go off camera for a bit. Or if my eyes get too tired to look. So I want to encourage folks to be able to do that as well. It's usually a very intense session in terms of this whole week, which is why we've learned through the years to build in the break times and the debrief times. Because I'm very conscious and Steve is very conscious that when you start having back-to-back sessions about all the health disparities that LGBTQ MOUSE folks live, that it can get really overwhelming. So we're well aware that this is something that you all have experienced to different levels, but that we wanted to make sure we had a way of sort of letting off the steam. And, the virtual student get together is not going to be the same as actually getting some bubbly and chilling for a while, but maybe you all can take your favorite drink and exchange some ideas with people across the pond in different locations and make some new friends and be part of the larger web that we are building.
Well said. Well said. Yeah, I mean, Zoom fatigue is something we've all learned how to sort of compensate with, and yeah, you should never feel bad about having to mute or turn your video off to go do whatever you need to do. So, and it's understood that not everyone can make all of the sessions too. That's a given, which is really why we've we've one of the benefits of this whole pandemic thing is we've learned how to do online much better. And to that end, we are allowing for virtual. We'll be designing the next couple residencies for people to be able to participate virtually. Most people, if they can, want to come to the residency in person because that's obviously a great experience. But for those who can't be there for all or part of it, we're at a point now where we've got sort of the tech and the virtualness down of it, where you can still participate in the program and not have to physically be here. So, silver linings on on things like massive pandemics. Okay. Well, unless there's anything else, our next point of convening is 30 minutes from now. And Shane Snowden will be presenting on LGBTQ data and health education. So we will reconvene then. I will see you then. Hopefully no one will have any problem logging in. I'll be interested to see what that experience is like, but you all should have that passcode now. Does everyone have the passcode in case they need it? Yeah, I'm going to paste it in here right now into the chat. But if for some reason you need it, this is the passcode. Did that go to everybody? Hopefully you did. Yes, okay. Nope, it didn't. I went to just Cat. Did you get the passcode, everybody? No, okay. Hold it. I just went to Cat. Sorry.
You got to change it to that little chevron at the sign to everyone.
I know how to do it, Kat. You just sent something to me, which is why it automatically went to you. Yeah. There's the passcode.
The other thing is that you have it set so that they can't chat to each other. There's a long-standing tradition of people like sending messages back and forth of, oh my God, I forgot this or that or the other thing. So I don't know if that's intentional with the recording.
No, it's not intentional. Let's see.
Because I've had to go to my phone and to Facebook for a couple messages already this morning.
Let me see if we can fix that. Zoom has this really annoying, I don't know if anyone's experienced this, but once you like set something up, it's very difficult to edit it. I don't know if everyone's had this experience. God willing, we won't have to like do a whole new link. But let me see if I can change that setting without creating a new link. If we do, it's, you know, that'll be fine. We'll just have to send out a new link, and but hopefully you won't have to do that. But if we do, we'll send out the new link. We'll send out the new passcode. And everyone
We appreciate everybody's good humor on this. Like I said, it's difficult enough to do this when we are in person, but taking into account time zones and technological issues and, you know, those kind of problems, we will have good humor. Get some caffeine and we'll come back on when Shane Snowden comes back at 11:15.
Great. So we'll see you guys in now 25 minutes or so. And thanks for coming. So see you in a bit. I'm stopping recording right now.